Assalamualaikum and very good day, everyone. So this lecture will cover on the topic subject 5, which is on compatibility and status. All right. So this topic consists of two main subtopics. The first one is on electromagnetic compatibility, and the second one is electromagnetic interference. All right. So for the electromagnetic compatibility or EMC, so EMC is the condition which exists when equipment is performing its design function without causing or suffering unacceptable degradation due to electromagnetic interference to or from other equipments. So EMC is when equipment works properly without causing or being affected by unwanted electromagnetic interference. So, okay. So if you are developing a medical device, you have to make sure that your equipment is EMC, is having EMC, electromagnetic compatibility. So when there is unwanted electromagnetic interference, so your medical equipments or medical device eh, can works properly without any interruption, without any problems. It can function normally. So this is very important. When we talk about medical device, so your medical device must be function normally in all environments and in all environments to ensure that it is safer to be used by the patient. Right? Okay. Now we look at the healthcare geography. So basically, we have a few conditions that is category as a healthcare geography. First one is a hospital, eh, clinics, home or chronic care, remote or telemedicine, and the last one is the mobile environments, which consists of ambulance or ambulatory patient. So we can see that each environment comes with its own unique and dynamic EMI and also EMC contacts. So now we look one by one for the hospital geography. So as I said before, so each healthcare environment presents a distinct electromagnetic interference and electromagnetic compatibility context due to its equipment density, usage, and exposure to RF sources. So these three uh, elements must be considered when you are developing a medical device. So the first one in terms of the equipment density, how many devices is used in that particular area or in that particular room. And then we have to look in terms of the usage pattern, who is using that medical device. Is it using for the intensive care unit patient, or is it the medical uh, device is used for outpatient subject? And then last one, you need to consider about the exposure of RF sources. So what is the example of the exposure to RF sources? What is the example of RF sources? One is the example for RF sources or radio frequency sources is your handphone or your mobile phone and your mobile phone. So that if you go to the hospital, but if you go to the hospital at certain area, your handphone is not allowed to be activated. You must switch off your handphone if you want to. Let's say you want to enter to the intensive care unit or ICU. So maybe there is a possibility that some of your device is not having good electromagnetic compatibility. When you bring your handphone to that near to that medical device, so maybe the medical device eh, cannot function properly. Okay, so that is the importance that you need to know. Right. Okay. Now we look one by one. Let's say we have the hospital geography or hospital environment, which is inpatient setting. So basically, when we look into the high equipment density, so eh, especially in ICU, eh, intensive care unit, in OR or operating rooms, and what's use many electronic device such as monitors, ventilators, infusion pumps, and many others. And now we look at the high of EMI risk. Eh? So the close proximity of the close proximity of the devices, for example, the monitors, ventilators, uh, and also the fusion pumps, can lead to interference. So because of uh, high number of equipments on in ICU rooms, which is located close to each other, so there is a possibility that uh, the electromagnetic interference will occur on that area, and maybe the monitors will interrupt the the function of ventilators. At the same time, maybe the monitors also can interrupt the function of the infusion pump. So this interruption may lead to the failures of the medical device, which is located nearby. So this is very important for us to consider the EMI risk on that area, right? So that's why we need a strict emergency requirements. So in this dense, uh, high equipment density, so we must to make sure that all of those equipment must not interfere with the life critical system. For example, here, if you focus on ICU, so the most life critical system is the ventilator. All right. So you must to make sure that all the monitors, all the infusion pumps or other equipments nearby the ventilators will not interrupt the function of the ventilators. Right. And then we move to the next hospital geography, which is clinics, which is outpatient and offices. So this area can be classified as a lower device density, but it still use some diagnostic tool such as ECG, uh, ultrasound, X-ray, and many others. All right. So in terms of risk from consumer device, so normally patient and staff bring smartphones and also laptops to the clinics and office. So there is a possibility, there is still a possibility that these smartphones and also laptops will interfere the system of other medical device, which is uh, ECG or ultrasound. Right. So this in this clinical area, it needs a moderate EMI control compared to the hospital environment. All right, now we move to the next environment or hospital geography, which is home or chronic care. All right, normally in home or chronic care, so normally we use there is a use of portable medical devices, such as the oxygen concentrator and glucose monitor and so on. So this area is classified as a non-controlled EMI environment. Okay, so in this area, the medical devices is surrounded by consumer electronics, Wi-Fi, and also microwave, exposure. And for this kind of medical device, which is placed in home or chronic care, must have a robust against everyday EMI. So based on the wide range of EMI environment, so that if we want to develop or we want to design this kind of device, so that we need to uh, consider a medical device with uh, having a robust against everyday EMI. All right. Now we move to the next environment, which is the remote or telemedicine. So basically, so in this area, so the medical device relies heavily on wireless communication, such as Wi-Fi, cellular, and also Bluetooth connections. So in terms of the EMI risk from data transmission device and also varying remote environments. So this kind of medical device requires strong wireless EMC and data integrity problem. All right. And then the last geography hospital environment is the mobile or ambulance or ambulatory patients. So we have to consider also the type of medical device that is located in the ambulance. All right. So for this device, normally it exposed with a high noise environment, and this device is constrained. eh, So such as radios, sirens, and also power system. And all of this kind of medical device must operate reliably during motion and exposure to varying MI. So when the ambulance travel, so it is exposed to the varying electromagnetic interference. So this uh, this is very important. Eh? Since we need to critically monitor the condition of the patients during the transport. Right. So in order to design this kind of medical device, we need to consider in terms of the mobility of the device, in terms of the uh, varying exposure of the EMI. eh? Okay. So what is the problem? What is the problem related to the EMI and also EMC? All right. So because of lack of understanding and management of EMI and EMC issues, so within the healthcare industry environment, so normally we can find out that most of the medical device have malfunction, which is resulting in serious injury or even death. And secondly, we are facing to the system failure, especially the system is uh, significantly or critically provide patient status and alert information. So these two elements is very important for us to consider to ensure that the medical device is electromagnetic compatibility to the electronic electromagnetic interference to ensure that uh, the medical device can function correctly and support uh, the health of the patient.